So we will start that now. In this session, we have another 6 students who will be presenting their work. They are all 6 students from the nursing department. I will introduce each presenter and then read the title of their presentation. So presenters, make sure to work on sharing your screen while I am introducing you. You will have 5 minutes to present your work and then an additional 2 minutes to answer any questions. I will give you a one minute warning if necessary. Judges, I will also be providing you with the participant ID number, which goes on the top of your judging form. All attendees will be muted throughout the presentation. However, when you are ready to present, you can unmute yourself. If there are any questions, then Ms. Harold can read those questions to you so you don't have to worry about the chat room. And so to begin, our very first presenter in session 2, we have Adam Coates. Judges, his participant ID number for your form is 16, number 16. Adam is presenting his work entitled, What Factors Influence Self-Management of Health? It's all yours, Adam.
My presentation is on what factors influence self-management of health. And so I'll start here. Okay, so what does this mean? Are you responsible for your health? So if you ask yourself these simple questions, are you doing all that you can to maintain your overall health? Are you educated about your medications and are you taking them properly? Do you feel like you're able to openly ask questions at your primary care visit? And do you feel like your provider's instruction, do you follow your provider's instructions and advice? And do you attend your provider appointments with your spouse? And how do you think this affects the tone of your visit? So in my research, these research articles address these questions. And so what do these studies show? An increasing number of studies done in the past 5 years reveal that healthcare providers are paying more attention to this aspect of care. There are endless factors that influence outcome of a disease process. The question is, to what degree can someone better their outcome if taking full responsibility by learning and utilizing their resources? Studies from peer-reviewed nursing journals cover specific topics to answer this question. Topics include patient perception of safety, self-managing chronic diseases such as arthritis, adhering to diet regimes, and demographics. These studies show that most patients feel responsible for managing their own health to a certain extent, but put the work in to do so. A positive correlation exists in self-management of chronic disorders and symptom presentation. Demographics such as education level and income impact the ability to self-manage health. Another interesting aspect of one study was that older adults are less likely to ask questions to providers with a spouse present. The fear of bothering a busy provider with questions is something most older adults feel. Also, older adults who live alone are less likely to self-manage their health. These factors are important to keep in mind when going forward. Asking yourself and educating yourself about your diseases and medications can lead to improvement of symptoms and better quality of life. So, what can we as nurses do to, taking all of this in, and what can we do going forward to help our patients be more active in their own treatments? So there are several interventions that nurses can take to promote self-management of care. Providing education tools. When we educate our clients throughout the day, we can give them information about community resources and offering plenty opportunity for patient questions and can improve responsibility. So whenever we're educating, just giving extra time, paying more attention so that our patients aren't, you know, so we don't try to show them that we're rushing or, you know, just giving them extra time to ask those important questions. Even when in a time crunch, nurses should offer themselves for education opportunities throughout care. Another intervention nurses can take is to assess for individualized factors that may keep a patient from being able to fully take initiative in their health. So such as their income, or if they live alone and they're older, these things can impact that. Teaching opportunities are when nurses can take extra initiative to explain and emphasize the importance of self-management. And these are my references. And, do you have any questions?
Good job, Adam. What made you interested in this topic?
I think that it's interesting to me because this is something that not a lot of people think about, especially healthcare providers. Just doing simple things, just keeping in mind these simple things that we can do throughout the day to you know, help patients feel more comfortable. I think that's important to keep in mind.
How do you feel that you can use this topic in your future nursing career?
Yeah, well, like I said, offering when doing education throughout the day, just offering extra time that can help, because you know, I think that if the patient's comfortable with asking questions and you build a rapport with that patient, they're more likely to ask questions that they won't if they're not comfortable with you. So I think that I'll definitely take that into consideration.
Do you feel that depression plays a role in a patient managing their health?
Yes, definitely. And that's something to keep in mind too. Like whenever you individualize their care. So if we know that they have depression or other mental health issues, that's something to take into consideration and, you know, as you go forward.
All right, thank you, Adam. Very nice job. Okay, we will move on to our second presenter. This presenter is Mackenzie Luke. Judges, her participant ID number is 1818. Mackenzie is presenting her work entitled, "What are ways to improve the outcome of pregnancy?" Mackenzie, when you're ready.
Okay, so I did mine on what are ways to improve the outcome of pregnancy. So muscular relaxation and breathing control has been proven to control gestational hypertension and decrease the risk of preterm labor, low birth weight, abruption of the placenta, or fatality. Prevention is always crucial, and the nurse should educate women on risk factors of hypertension and proper methods for relaxation. Early education of gestational diabetes has shown to decrease the occurrence during pregnancy. The decrease also minimizes the risk of babies that are born with type 2 diabetes. The nurse should never assume that women already know a proper lifestyle. She should ensure that they have available resources to be able to exercise or eat healthy. Educating teens on pregnancy and the risk has shown to reduce complications such as inadequate nutrition and even death. Lack of knowledge showed to be the main cause of teen pregnancy. About 80 to 90% were unaware of the hazards or prevention measures. Nurses should educate teens on the risk and prevention methods. And domestic violence is particularly dangerous during pregnancy. because it can cause premature birth or death. Approximately 70% of crimes happen by their own partner. The nurse should establish a good rapport, which will encourage the woman to seek help if needed, provide resources that the mother may need to improve her quality of life, which could also improve her child's quality of life. Stress is often high during pregnancy and can impact fetal development. The weighing pregnancy stress scale can be used to detect stress before complications occur. The scale actually proved to be 99% accurate in detecting stress early in order to minimize dreadful difficulties. The nurse should evaluate the emotional state of the woman and use the scale to provide an individualized plan of care for her. And these are just some pictures to talk about domestic violence and how it could be prevented, the possible complications, and how to help manage gestational diabetes. And these are my references. Any questions?
What did you learn that you'll take into your practice?
Well, I've learned that there's several complications that can happen during pregnancy. And I chose this because I want to be a labor and delivery nurse. And I think that prevention early on could lead to these women not having so many problems and a healthier pregnancy.
Good. And what made you interested in this topic?
Well, I'm going to be a labor and delivery nurse, so I think that it's important to know a lot of these things and to understand the prevention of them and the things that they can cause if not prevented.
What do you think was the most interesting part of your research?
The most interesting part, I think, was the teen pregnancy, how dangerous that teen pregnancy could be or how many complications that they have. But it really made sense because, you know, their lack of knowledge is really what leads to the complication because they don't understand the proper nutrition that they need or like that drugs can affect, you know, the pregnancy as much. They don't think about those complications. So I thought that was pretty interesting because I wouldn't have thought that just teen pregnancy would have such a strong impact.
Anybody have any other questions?
Okay, then. Very nice job, Mackenzie. Thank you.
Thank you.
Okay, we will move on into our third presenter for this session. This student is Elena Canterbury. Judges, Elena's participant ID for your form is 19. Elena is presenting today on her topic entitled, What Contributing Factors and Preventative Measures are Associated with Medication Administration Errors? Whenever you're ready, Elena.
Thank you, Ms. McMillan. Let me get this up. Okay. So like Ms. McMillan said, I did my presentation about medical errors, specifically medication errors. These are just some pictures about what we're going to talk about. So first I want to talk about contributing factors. Patients have the right to quality and safe care. So when I was doing my research, I noticed that a lot of times errors fall into 5 categories, which is your patient medication rights. And most time nurses report giving medication at the wrong time. That's the highest rated medical error. So when I was also doing my research, I pulled articles from different nurses from across the world, and most of these studies included questionnaires asking nurses to say, like, what limitations do you face? What causes your medication errors? So nurses in Jordan, a lot of times they report like unsafe patient ratios. They can be 13 to 14 patients to 1 nurse, and that's just absurd. So of course that can lead to mistakes and errors. They also report limitations in equipment, unfamiliarity with the medication, and insufficient trainings. Pediatric nurses report that, of course, distraction. So like Mackenzie was saying, parents play a big role. So parents, of course, are going to ask questions, and you've got kids and maybe siblings in the room, and so distraction can cause medication errors. And then a lot of times they also report prescription interpretation. I think we've all had that time where we see a doctor write a prescription and you cannot decipher it. So I could definitely see how this would be a major problem. So I also found an article that I particularly liked because it came from the perspective of nursing students. So that's all of us and what we've been doing for the past several semesters. So a lot of times nurses report a lack of confidence and fear of failure for their medication errors. They may not know how to use the skill, how to use equipment, and they may just fear their instructor may not get proper feedback. I can say that our instructors are super great at feedback, so I can see how a student who doesn't have that relationship with their instructor could feel like they're making mistakes. But these simple mistakes are the ones that could affect our patients the most. So preventative measures, what can we do to prevent these? Obviously, we can report. So one research article that I looked at asked nurses to say, okay, how often do y'all see reporting, whether it's yourself or a coworker reporting medication errors? And through that article, there was not a high evidence of reporting, but it's also shown that in hospitals that do promote reporting errors, that the correlation decreases. So the more reporting there is, I think others are allowed to learn from their mistakes, or just document and keep up with it, and it leads to less mistakes in the future. So like I just said, reporting, they can also document these errors. So when a healthcare facility sees that maybe one unit, they're making a bunch of mistakes on the same thing, they can hold a conference or something to help educate. Because like I said, education and communication is so important. And then it comes to something just as simple to prevent medication errors. Listen to your patient and teach them about it. If you have a patient coming in and you're giving them a medication and they say, oh, this isn't what I take at home, don't just shove it in their mouths. You got to stop, ask the doctor, be a patient advocate, and make sure you're giving them what they're supposed to have. Another preventative measure, I read a lot about the electronic medication administration records, which is the EMR, which I think most of us are familiar with. So this tool is a program in the computer, and it helps prevent medication errors because it requires things like patient identification, and it makes sure that there are no discrepancies in healthcare orders and the dosages that you're giving. So it's a really, really useful tool to prevent errors. So what can we do as nurses or future nurses? So education lays the fundamentals. Like you said, we're in school and we've been learning so much. So when I read an article saying that students are making errors because of lack of confidence or lack of education, I think that's a very simple thing that we can fix. So making sure they have proper training, or like LSUA, we do simulation labs and skills labs. That's a great way to increase confidence and make sure that they're practicing skills the right way. Another thing that nurses can do is implement reward system for reporting. Of course, nobody wants to admit when they mess up, but reporting is a great way to keep track of what's going on. And it can also, you can speak like a testimonial. I've done this, don't make the same mistake. So the biggest thing is patient safety, safety first. So every nursing area is affected. That's why I pulled different research articles from different parts of the country, like Jordan. I pulled an article from nursing students and an article from pediatrics. There's errors everywhere. It's not limited to just where you're going to work. So it's really, really important to know that this goes on everywhere. So the biggest thing, why this is important, you want to know where the problems are in order to fix them, how to improve. And so why does it matter? Like I said, we're nurses and we've had this essential worker going on, and we play a vital role. We see the patient a lot more than the doctors and some physicians do. So we can speak as an advocate and make sure we're providing safe care to our patients. And these are my references.
Great job. And you got a lot of feedback. So first question, did you find any research relating to self-reporting medication errors?
I did. There was one article that focused on self error reporting and coworker reporting, and really, I found the article showed that nurses who had more experience tended to report more. I think they had more confidence in themselves, whereas newer nurses, younger nurses didn't really self-report. They were more apt to report about someone else's error.
Okay. And research has shown that main error that new grads make is medication error. So what do you think is a contributing factor to that for new grads?
I think a contributing factor, I think, especially us going in as baby nurses, I truly think a lack of confidence or a lack of familiarity, because yes, nursing school teaches you a lot, but it can't teach you everything. So I think when you're going in and starting this on your own, it's a little daunting. So I think that can lead to medical errors.
Okay. And as a new nurse, what part of the PowerPoint is the most important to you for you to know before starting work in the healthcare world?
Before starting work in the healthcare world, I think it's important to know like the reason behind what other nurses are saying they make mistakes. That way you're aware of it. I don't think you can really fix a problem in yourself or be aware of it if you don't know that's there. So I think it's important to be aware of what other nurses are saying. Hey, this is a problem. This is a problem. You can go in and expect to fix it and how to fix it.
I'm
And
gonna stop it
medication
right there,
would
Julie.
be inevitable for most. In your opinion, does the atmosphere of local hospitals encourage reporting of these errors, or do you feel more nurses are tempted to leave these errors underreported for fear of being reprimanded?
That's a difficult question. I've had the ability to work at both hospitals, and really think it depends on what unit you're on and what your manager is. I think the overall attitude is it's a more at both hospitals is a more welcoming. We want you to tell us what's wrong so that we can fix it. We can treat our patients with respect and the care that they deserve. So I think reporting is pushed more.
Okay, I'm going to stop it right there, Julie. Thank you, Elena. Wonderful job.
Thank you.
Okay, we're going to move on to our next presenter. This presenter is Victoria Douche. Judges, her participant ID number is number 20. Victoria is presenting for us today the research and the information she has found on her topic entitled, "What Challenges Does End-of-Life Care Face in Healthcare Facilities?" Victoria, when you're ready.
Hey everyone. Okay, so like Ms. McMillan said, my question or my presentation is about challenges. What challenges does end-of-life care face in healthcare facilities? So this is just a cute little picture that I found. I actually loved it for end-of-life care. I feel like it just kind of explains it in its own way, or however you interpret it. So just a little summary of my research. There was two main things that I found that were challenges in the healthcare field. The two main ones were education and communication. So education was a big thing. Like Mallory said earlier in the other session, I feel like there's not a lot of talk of end-of-life care. It's kind of a hard thing to talk about. And especially with patients and families, you know, that's not something you want to think about. But I mean, in these critically ill patients or terminally ill patients, I mean, it's inevitably going to happen. It's something that you need to prepare for and teach the family that, you know, the disease process. So in one of the studies, they did a test to test the education to evaluate the education of end-of-life care. And they actually did like seminars to help educate, since there's not a lot of education of end-of-life care. And it was actually showed that that it actually helped, and nurses were learned more about end-of-life care and how they can improve. And not only nurses, but you know, healthcare like aides, CNAs, social workers, all of the healthcare team. Another one reported that older nurses, like years and years of experience, actually were more comfortable in the topic of that and the education of end-of-life care. So education is a big key. I feel like it needs to be taught more, since it is going to be in every aspect of nursing. Another thing was the communication. So I had a couple of studies that did research on this. So one of the articles, the least reported activity, was the family sharing feelings concerning death and funeral arrangements. Like, nurses usually didn't talk about that. And like I said before, I mean, it's a conversation that needs to happen, although it's not the, most wanted conversation, but it needs to happen within the care of the patient. And not only conversations of end-of-life care, but there was also, in another study that I found, there was problems with communication with the family, like just normal conversation. Patients who have this terminally ill diagnosis, it's important to have one side of communication of the end-of-life care, but also check on them and support them, and not only talk about that diagnosis or the patient themselves. So nursing relevance, it's always a sensitive subject in the healthcare field of end of life. But it's something that needs to happen. I feel really strongly about this because, I actually work for a hospice company. So I do see many cases of this. And I feel like just being there for these patients and with their diagnosis is really important. I know a lot of people tend to focus on getting patients better, and I mean, that's good stuff, but with these terminally ill diagnoses, it is kind of challenging, and I feel like there should be some more education on it, just so nurses know how to approach that. And not only education but communication. I know we're taught therapeutic communication throughout our studies, and I feel like it's a big deal with everything we're going through, especially end of life care. And here's my references.
So what made you want to do this topic, seeing as it's such a touchy topic?
Like I stated earlier, I do work for a hospice company, so I do see this a lot. It's just something that I feel passionate about. I know that kind of stuff isn't for everybody, and there's different stuff for everybody, but I just feel like it has a special place in my heart for those people. They need just as much love as other ones.
Do you plan on staying in the field of hospice?
I do. I feel like in the future that would be something for me. As for right now, I'm actually more into the intensive care, which intensive care that you are going to see those type of patients, but in the future for sure.
Any other questions? What did you learn in your research that you'll take into your practice? Did you learn like a certain communication style that you thought was best, or?
Well, I did state earlier, not only like end of life care communication, having those plans set out for these people, but also just checking up on the family. I know a lot we talked about, caregiver role strain, taking care of the family, not only the patient, because I mean, they're getting affected just as much as the patient. And just communication both ways. I feel like, especially with Allie's PowerPoint about communication, is such a big deal in the nursing profession. That's just like one of the core things,
Okay, thank you, Victoria. Great job.
Thank you.
Our next presenter that we have is Lana McGee. Her participant ID number is number 22. And Lena's topic that she is presenting on is, why do critical care nurses experience burnout so easily?
Mine wanted to disappear on me. Can y'all see it? Okay, so I did mine. I'm Lena. I did mine on why critical care nurses experience burnout so easily. So what factors can contribute to burnout? Stress due to increased workload, long hours worked, and intense involvement in bedside patient care. Occupational stress that affects a nurse's resilience or their ability to overcome difficult situations. Fatigue, work environment, and their workload. The nurse's level of competency in the critical care area. Personality and religious traits, and also moral distress issues. Stress acquired while being employed in the critical care unit stems from high workloads, more one-on-one intervention care, and more working hours at the patient's bedside. One of my studies conducted determined if a stress management program can improve nursing care quality scores. These results concluded that implementing stress management programs for nurses in critical care can decrease the amount of stress that they have due to their workload and family stressors and various outside things. By improving the way nurses manage the stress that goes along with working in critical care, we can improve the overall quality of the patient care. Occupational stress is another issue. It can result in turnover, conflicts among staff, and low quality of nursing care. A study conducted to see if these stress factors affected a nurse's resilience. These nurses were placed in 3 categories and participated in different training methods. And after the study, it was shown that participating nurses in these studies, their mean resilience score was significantly increased. Critical care is an area of high stress, and any intervention that can be implemented to improve patient care is beneficial. So incorporating training methods can lead to higher job satisfaction and learned resilience, which is going to overall decrease the rate of burnout and improve quality of patient care. Mental and physical fatigue will have a negative effect on patient care, as well as a negative work environment and a high workload. This study conducted using assessment scales, and they collected data based on those factors, and it was proven that a work environment has a positive effect on patient care. In this study, we couldn't really go with their workload because they were on a strict 1-to-1 ratio, which would be nice, but we know that's not always the reality, and they never go over 40 hours a week. I've witnessed firsthand that a happier work environment can directly relate to better patient outcomes. If you have a trusting unit with a good environment to come to each shift, it's going to benefit the other nurses and the patients. Clinical competence is an area that could bring added stress to the critical care setting. I know, especially as baby nurses, when we were first starting out, if you feel like you don't know what you're doing, it's gonna affect patient care. So it's very hands-on in critical care, and it's an intense area. So if you don't have the competency, then it's going to affect your self-esteem and your confidence, and then it can make you feel like you can't perform your job efficiently, which is going to lead to job dissatisfaction and burnout. Another study that I viewed compared the relationship with personality and religious traits to see if it correlated with burnout. And this study showed that age and working experience weren't associated with burnout, but exhaustion, neuroticism, psychoticism, and spirituality did correlate. Our personalities play a large factor in how much we can handle before burnout is reached. And an example of this is coping mechanisms. So if a nurse has poor coping mechanisms, they will not be able to adequately handle end-of-life situations that are often encountered in critical care. And from here, these poor coping mechanisms will spill over into all areas of their career and their life in general. My last article I researched, it was a study that compared moral distress with the rate of burnout. And in critical care, there are many moral dilemmas that are going to arise from the workload and maybe lack of communication, or you feel inadequate because maybe you do lack that competency. And this study concluded that applying strategies to reduce burnout are absolutely necessary. If we don't, then turnover rates and burnout due to shortages are only going to get worse. So what can a nurse manager do to decrease staff stress? To help ensure that the stress of their employees are limited, managers can be aware of each employee's efforts and mindful of their workload. They can delegate so that they're not micromanaging, which can build trust. And it's important they ensure their staff take adequate breaks. And it's also important that the nurse manager make sure that they are appropriately dealing with their own stress factors so that they can be better mentors. Here's just a little algorithm that I found that shows how working in the intensive care environment, personal characteristics, organizational factors, and moral distress can all contribute to burnout. This can lead to increased job turnover, PTSD, and decreased patient satisfaction and quality of care. And that's all.
Great job. Do you think that hospitals should be more aware of the signals of burnout of the nurses?
Absolutely. I absolutely do. I think that, I've been in situations to where not only as a fellow nurse do you pick up on it, but the patients do also. And so if the patients are picking up on these signals, I think that it's going to affect their trust with their nurse, and, it's going to impact their quality of care. So I think that nurse managers should absolutely be mindful of that and look for any signals.
And in your research, did you find any specific methods that help more than others when trying to manage stress?
There was one that I researched where they did training seminars. And so the nurses went to these seminars to kind of teach them stress, how to cope with their stressors and different things that they can do to stay in check with themselves. And it seemed to have a pretty good outcome. And I think that stuff like that's very important. I did state in my literature review, the only issue I could see with stuff like that is cost effectiveness, as far as the hospitals, having to provide things like that. I know we'll run into issues with budget and everything like that, but I think that it's important. And I think that especially in critical care.
Thank you, Lena. Good job. I'm going to ask Lena that there are a few more questions in the chat. If you don't mind answering those just for the sake of time so we can move on to the next presenter. Thank you. And then our final presenter we have for session 2 is Lauren Lee. Judges, her participant ID number is 36. Lauren is presenting today on her topic entitled Patient Handoffs. When you're ready, Lauren.
Okay, so how do patient handoffs impact patient care? Ineffective communication has been shown to be one of the leading causes of preventable medical errors in the United States. Gaps in communication during handoff processes continue to exist, resulting in increased vulnerability to patient safety. A variety of different studies were performed to evaluate the effects communication has on patient safety. A review of the literature reveals that an effective handoff should be conducted face-to-face, taking as much time as necessary to accurately communicate information, and be a two-way process ensuring accurate communication between both participants. The results from the review shows an efficient, timely, and complete patient handoff contributes to patient safety and to nursing staff and patient satisfaction through the exchange of information that has the potential to reduce error. Handoff reports lacking important standardized information have been directly associated with incidental events, errors, and near misses among nurses. During the handoff, ineffective exchange of information creates opportunities for error, resulting in incomplete and inconsistent sharing of information among care providers. Use of a standardized bedside handoff process results in an improved perception of communication among nurses and a reduction in length of handoff time. With the effective exchange of information between care providers, medical errors and incidental events can be prevented, resulting in improved patient satisfaction and safety. So, relevance to nursing practice. Handoff report is an essential intervention for healthcare workers. It has been shown that patient handoffs contribute to patient safety and patient satisfaction. The exchange of accurate patient information via handoff can result in better patient outcomes. With nurses being the coordinators of care, they hold a primary role in ensuring proper and effective patient handoffs to improve patient safety and care. Based on the reviewed literature, inadequate patient handoffs have the potential to be associated with incidental events. One of the ways to ensure that adequate patient handoffs are being implemented is using a structured and consistent approach. Continual education is essential to the sustainment of bedside handoff. Bedside handoffs improve the efficiency of shift reports, decrease the occurrences of missed information, improve patient safety, and save money and time. The need for consistent reinforcement on a bedside shift reporting format fosters open communication between the nurse and patients.
One of the ways to ensure consistent reinforcement on bedside shift reporting format is by providing the format during each orientation to the new nurses. In addition, it should be included in an annual competency so it is effectively integrated as an essential change over time. So I use the picture on the left, S-bars, because we have been drilled that in our head since the first day of nursing, basically. And the S-bar is an acronym that is used to facilitate prompt and appropriate communication. And as you can see, S-bar stands for situation, background, assessment, and recommendations. And there are my references.
Good job. So in your experience in clinical, have you ever seen like a poor handoff? And if so, what was the outcome?
So there's been multiple times where I have seen poor handoffs, even from like my working experience. And I definitely think that a good handoff gives you a good foundation for the shift. So if you don't have a good patient handoff, I feel like you don't have a good foundation, it can lead to a bad patient safety.
Okay. And how do you feel that this topic will help you promote patient safety?
I feel like this topic will make sure that I try to give the people that I'm like communicating to my patient handoff to make sure it's very efficient to like provide good patient care and improve patient safety.
And how will your research influence your personal handoff style as a nurse?
So I like, whenever I do patient handoff, I like being at the bedside. And I feel like being at the bedside is better because you get face to face and you actually get to see like who you're caring for instead of doing it at the nurse's station and not really seeing who the patient is.
Do you feel that your research has better prepared you for handoff reports when you start your job?
Yes, I think so, because now after this research, I know how critical patient handoffs are. So I feel like it'd be better knowing this stuff going into my work.
Good. Any other questions?
Okay, thank you, Lauren. Nice job.
Thank you.
So this concludes our session 2 of presentations. So we will stop the recording now at this time. We will